Hi, my name is Renee, and welcome to my mind map tour of what I envision to be the future of health. So, the current state of healthcare is that it is a system in crisis and it's not meeting our needs. A lot of people say that healthcare is too expensive. People doubt the ability to take care of their family's well being, and a lot of people can't get the care that they need. And this is such an important issue because health is everything to us. So, the question of care greatly affects our lives. So if it's not meeting our needs, then we really need innovative solutions and change on a systemic level. As you can see from the two charts here, the number of uninsured Americans has been increasing and it continues to rise. Additionally, health insurance premiums are expected to increase over the next decade significantly. The healthcare system is a very complex one and it's very deeply entrenched. So the question is, where do we go from here and what is the future of health? This is a really important question because what we identify as futuristic will shape the conversations and actions that we take today. So it's really important to give this question of the future of health really careful consideration. So let me tell you my vision. The future of health is collaborative and socially empowering. It's holistic and it's technologically innovative to support these greater values and social aims. The future of health is socially empowering in that it's culturally appropriate and socially just. That means we acknowledge historical and generational trauma of the disadvantaged communities, and we face the physiological effects of social and political oppression. It means that we understand the need for culturally appropriate care. This goes beyond the simple inclusion of traditional foods and medicines and actually calls for the genuine understanding and comprehension of multicultural models of health and illness and their core beliefs. This also means that we understand the social effects of explanatory models of illness and their social constructs. And finally, this means that we explore how traditions can in fact be quite innovative. So the future of health is collaborative in that we embrace mass collaboration. This can happen a couple ways. One of the ways is crowdsourcing information, epidemiological data, innovation ideas, and treatment information. And we can utilize social media to gather and report this data. So here are some examples of projects that are utilizing crowdsourcing. The first one is the Health Tracking Network, where volunteers can sign up and submit their symptoms for common illnesses. The second one is Google Flu Trends. They use their aggregated search data to estimate and track flu activity around the world. And finally, there's Cure Together. Cure Together brings together patients that are undergoing treatments for particular illnesses. Here we see depression treatments. So patients can submit information as to the efficacy of the treatments that they're undergoing, talk therapy or Wellbutrin, pharmaceuticals, exercise, and then the information is analyzed and presented in a chart like we see here. So this can actually provide really unique information and insights as to the efficacy of clinical treatments. So for medicine and the healthcare system to be socially empowering and collaborative, we really need a culture change in medicine. One that encourages disruptive innovations and adopts a patient-centered approach to clinical care and takes an integral approach to medical practice. So the future of health is holistic. It's holistic in that we focus on health promotion and not just disease management. That we cultivate a health care system, not a sick care system. So this means that we can adopt a positive orientation to health and utilize a values-driven approach to policy and systems design. And we can also allocate resources to prevention and education as opposed to expensive second-line treatments like hospitals. So the future of health is holistic in that we begin to prioritize long-term resilience. This means cultivating strategies for long-term human health and biological adaptability. This means seeing the big picture as well as taking care of short-term needs. So we can do this by advancing food security and local food systems. We can strengthen the social fabric and community life. And we can explore and utilize resilience and complexity science to gain insight into the complex dynamics of human and ecosystem health, as well as gain insights into how we can manage emerging epidemics, not only infectious diseases, but chronic diseases, which are very quickly becoming a very significant public health issue. Finally, we can talk about long-term resilience in terms of values. I believe that adopting values of resilience and nourishment in health systems design will help us reach this end. So the future of health is holistic in that it acknowledges the interconnectedness of human, animal, and ecosystem health, because these things are fundamentally interconnected. So how might health policy and care systems reflect this fundamental connection? Well, first, we can adopt sustainable medical industry and research practices. One of the ways we can do this is by enacting something called the precautionary principle, which basically says that better safe than sorry. That if there's any question as to whether a certain initiative or product or practice is going to be harmful, let's be safe instead. We can also do things like establish better regulations for the responsible disposal of pharmaceutical waste and utilize approaches like life cycle analysis and cradle to grave for medical equipment and product manufacturing. We can also take an integral approach to conservation and land management policy that takes into account public health. So this means that we implement environmental and land use policies that acknowledge public health effects of ecological imbalances. One example of this is the rapid emergence of certain vector-borne diseases that have arisen from disrupted predator-prey relationships. We can develop better risk assessment tools that take into account ecological complexity on a deeper level. And finally, we can acknowledge ecosystem services in land use decision making and acknowledge the role of biodiversity in planetary health. Finally, we can develop better environmental and outdoor education initiatives. And we can educate citizens on ecological health and planetary interconnectedness. And we can get people outside moving and interacting with others. Finally, the future of health is technologically innovative. We can use technology as a means to an end towards a vision of individual and collective health and well-being. There's a couple ways we can do this. Two that are current right now is mobile app technology. This can provide insights into health behaviors and help mirror this back to users. And we can implement gamification to incentivize fitness efforts and dietary changes. And then there are also medical technology breakthroughs that reduce the cost of care in certain treatments to patients and therefore increase their accessibility. We can also evolve information systems to help streamline care and improve case management. So that's what I see and envision as the future of health, that it's collaborative and socially empowering and holistic and balanced and takes into account the interconnectedness of human and ecosystem health. And finally, we can pursue technologies that assist in the development of this bigger picture and in the creation and design of a system that really does meet our needs. So thank you for watching, and I believe that some of these insights will help contribute to a better understanding of the system and the possibilities before us.